are tight, aren't you? To see what range we have in the hip and is it comparable. So he's tight when I take him to 90 degrees, right? You have a walnut? Oh, a wallet. That's random. So we would pull them passively into hip flexion, and we're checking for hip flexor tightness. The best test, though, I do for it is called the Thomas test, where you're going to scoot to the edge of the table, but jump off a second and pull this table back. Right to the edge of the table, literally like you're hanging off. Then you're going to sit back, tuck one knee into your chest as you sit back. So like that. Now tuck right knee into your chest or left knee. So we're holding there, tuck, hold. You can't even hold that, can you? And what we're looking for is if the leg isn't at the very least parallel to the ground, we're saying yeah, they definitely have a tight rec fem, tight iliopsoas, and then we would switch sides, tuck left leg into other side, and obviously we're bilaterally comparing. So he's pretty tight. We're about parallel, but we can definitely tell he's got like some hip flexor rec fem tightness. So Thomas test is truly a rec fem tightness. If he rotates out to the side, so if we see this, we start to also consider that he's got a tight IT band. So we do that as well. So I'm flicking. Faber's test is a crossover test for SI joints. So scoot back. You can come a little bit closer. Keep going. So Faber's test, you would lie back. You would cross over the side that is you're concerned about, or other side. You're going to do both anyway. We're worried about SI joint at the back. Okay. So we're going to stabilize ASIS on one side, and we're going to passively externally rotate the other side. And what we're looking for is pain at the SI joint, basically pain in their back at the SI joint. Then you would do the other side. Sometimes you'll get opposing pain, which is also sometimes be a sign of SI joint issue. So we're going to hold ASIS, passively externally rotate them while the legs are crossed, and we're looking for pain at SI joint. Gainslands, I'm gonna. IT band. So actually stay there for a second. We'll do Noble's test. So Noble's test and Ober's test are your IT band tests that I want you to know. For this one, you're going to compress. I'm going to have the leg at about 90 degrees. I'm going to compress the IT band. I usually use 2 arms to compress it, but sometimes you might want to use one because it's technically a passive test. I'm going to compress on the IT band, and I'm going to extend the leg up. And what I'm looking for is, one, does that increase the pain? Does that create the pain that they're having down the IT band? Or are you getting any clicking, popping, snapping over the IT band? That's what we're looking for. So we're going to compress the IT band, and we're going to passively extend. Some people will do it in active extension as well, which can work as well. Ober's test, lie facing that way.
This way?
Yep, it's kind of an awkward test. You're going to like 90 degree the angle of the pelvis, keep that hip forward. I'm going to try, what we always say is we're going to try to bring the pelvis up and back. Oh, you've got to scoot further back to the back of the edge of the table. Keep going. Come on, Bryce.
Like this, right?
Yeah, keep going. And what we're looking to do is, again, it's a parallel check. So we're looking to see, you are super tight. We're looking to drop that leg down, you're so tight. And if that leg doesn't drop to parallel, or drops less than parallel to the floor, we're saying he's got a tight IT band. So we're basically just looping it up off the greater trochanter, and then we're just dropping down to try to see if he has that tight IT band. The other one we can do for IT band check, stand up for a second. It's just like a knee flexion test. So we would actually have them stand on one leg without sandals on, ideally. So, and we would have them drop down, single leg. You can even have this right leg back onto the floor if you want. And we would drop down into about 30 to 40 degrees of knee flexion and then come back up. And again, if they're getting pain through the IT band, it's a pain provocation test. So that's what Bren's test is checking for. Glute med weakness. So this is a cross-country runner test. So face this way. Keep going, step. So hold your t-shirt like that is important. So what we would have them do is we're going to raise, so you're going to basically stand here like this, one leg up. So if we're testing, this is the standing leg is the leg that we're testing. In a normal non-irritated glute med, the pelvis on this side should raise up slightly, which it does. Drop that leg back down and raise the leg again. Notice how pelvis raises up slightly. Now what I want you to do is show me what a positive test would be. So you're going to raise that leg up, but drop down here, there. If we see that, it's saying this glute med is weak, because what happened is he raised the leg, and rather than his pelvis go up, he dropped down, which is showing the glute med is weak on the standing leg. So you're testing the standing leg. Raise the other leg. Pelvis should raise up. If it fails to do so and it drops down on the uninjured side, it's a sign of glute med weakness. Tons of cross-country runners have glute med weakness. The other hip flexor test, I missed out one. Lie on your stomach. So we did Thomas test, which is hanging off the edge. The other one is Eli's test, really simple. You're going to passively flex them, heel to butt. And what you're looking for is, does the hip hike upwards? So basically push your glute to the sky for me, to show me a positive test. Now just on the right side. So if we see that hip hike, that would be a positive sign. His doesn't really, so relax back down. But what I notice is quite a lot of resistance there, where the heel should pretty comfortably touch the butt. So if the heel's not comfortably touching the butt, we know we've got rec fem quad tightness anyway. If the hip hikes upwards, then that would also be a sign that the hip flexors are really tight. It's a hip flexor tightness test. It's not a pain test, just looking for range of motion. Does the hip hike? Scoot the edge. You see, what was the last one? Scour test. Oh yeah. So if you're worried about a femoral stress fracture, not an acute fracture, because you can't do a special test for that. You'd know about it. They'd be internally rotated in pain, and their leg would look shorter than the other. So what we would do is we would basically put the arm under here, and then we would push down here, and it's called a fulcrum test. And we're looking for, does it create pain along the femoral shaft with my hand down here. I just want to make sure my position is perfect on this. I'm not on the right test. I'm way off the test. Yeah, so we would be here, and then we would basically torque the femur. We're looking to kind of torque the femur, see if we can create a bend and a load on it, and you're looking for pain through the femur, deep lie into the quad, right? The last test is the labral test that we do, so we lie back. So remember, labrum is a joint, so passive testing would work for it. We get them into that 90-90 position like you would for, I guess, Godfrey's or Noble's test. But this time, I'm going to try to load the femur. The only way you can do it for a scour test is like put your whole body through, and then you would basically internally and externally move, or like adduct and adduct, right? So it doesn't hurt you, does it? No. You just push through, and then go like this. Obviously, I'm super strong, so it probably just feels like I'm crushing his whole leg. But the goal of it is, does he get pain deep into the hip? And if he does, that might be a sign that he has a joint issue, labral issue at the hip scour test. Those are the main